Welcome back. North Korea has announced its first COVID death just a day after reporting its first official case. Now, there are 18,000 new so-called fever cases and the country is in lockdown. North Korea's state media says more than 350,000 cases of unexplained fevers have been identified since late April. We know, of course, that fever is a key symptom of COVID-19. And in a country that has little to no vaccination against the virus, it is a worrying sign of an outbreak. Well, joining us now to discuss more is CNN's Will Ripley, who joins us live from Taipei, Taiwan. Good to see you, Will. So it's quite incredible that until now North Korea hasn't announced any COVID deaths. They've just announced one, especially given the low vaccination rates. How is North Korea responding to this surge in cases?
The fact that they're publicly putting out in state media, Lynda, confirming the presence of COVID-19 and essentially the failure of the North Korean hermetically sealed border for the last 2 years that North Koreans have suffered in order to maintain this state of isolation that led them to hold a massive military parade last month with tens of thousands of people not wearing masks and feel confident that they would be safe, even though just across the border in China, the Omicron variant is raging across that country, which is also sealed off. It shows that really the North Koreans were, really pretty much taken by surprise here and are now desperate. Because to confirm COVID-19 to the outside world and then talk about hundreds of thousands of people sick with this fever, they don't have the testing equipment, Lynda, to necessarily verify that it's Omicron, but they also don't have ventilators. They don't have the kind of medical training and facilities to treat the huge number of people who would be at high risk for a severe case, especially in a country where 40% or so of the population doesn't even have a nutritious diet, not to mention access to modern medical care. So it could potentially just be horrific, Lynda.
Yeah, it certainly could. And it's interesting to know that South Korea has offered testing equipment and vaccines. Any indication of whether North Korea will accept that? Because I understand they have rejected vaccines in the past.
Amnesty International claims that they were offered millions of doses under the World Health Organization's COVAX program. North Korea and Eritrea are the only two countries in the world that have not vaccinated their general public. Now, is that to say that Kim Jong-un and his top aides didn't get the vaccine, somewhere along the line? We have no way to know, but certainly officially no vaccines went into North Korea. They rejected the offer. There were some Chinese-made vaccines. There were other brands. It wasn't Pfizer that was offered up, but it's not entirely clear why they said no, why they turned away millions of doses that potentially could have saved lives. I think the fact that they're now publicizing this urgent need and this national emergency, this explosive outbreak, as they call it, might be a sign, Lynda, that they are ready to receive international help, and it's needed pretty badly. The question is it going to come in time? There's a Chinese state media reporter based in Pyongyang who basically put out an update on his own status. This is an expat with a lot of privilege who barely has a week's left of food in his apartment and wonders what's going to happen because the government hasn't said anything. If that's the situation he's in, what are these families who don't have that much food in their homes facing right now?
Yeah, extraordinary. You make a really good point. We will stay on that story. Will Ripley for us in Taipei. Thanks very much.